Welcome to our CardioStar program. We are very happy to have here Professor Boehm, Director for the Clinic of Internal Medicine of the University Hospital of Saarland, and also past President of the German Cardiac Society and the Chairman of the Congress Program Committee for the ESC Congress. We are very happy to have you here, and we are going to make you some short questions. Where did you grow up?
I've grown up in the north of Germany, in the city of Hanover, which is a flat area with a very good university and medical school and a lot of good other schools, and this is my hometown.
Do you have any particular mentors that inspired your career?
Yes, I did my doctoral thesis in the Department of Biochemical Pharmacology, and this was dealing with pharmacology and biochemistry of the heart. This is Professor Scholz in Hamburg. And then I moved to Munich to Professor Erdmann and Professor Rieker. So these were my mentors and trainers. Mm-hmm. And then I think they set the stage for my further developments.
You have been for the last 2 years the chairman of the CPC committee. How do you build this big congress?
The big Congress is not the effort of a single person. We have an excellent staff in the European Heart House, and we have a very effectively working program committee consisting of about 40 to 50 members. And so this was an effort of the whole group to start and to generate this big program here, and it was a lot of fun and very effective as well.
Thank you for your answer. We want to look a little bit to the future. What is your vision about healthcare and cardiology for the future?
For the future, I think most important is to change lifestyle behaviors in order to prevent hypertension and cardiovascular risk. And when risk is effectively prevented, we will prevent events, and at the end of the day, we will prevent heart failure, which is one of the major challenges today.
Mm-hmm. What do you think is the great advance of the last year in cardiology?
I think the new interventional techniques are most interesting and fascinating. This involves valve replacement, TAVI techniques. This involves also mitral clip, and a new technology which is renal denervation, which is high-frequency ablation of renal sympathetic nerves to treat resistant hypertension. And these are a very high-risk group of patients we are now able to cope with, which was not possible before.
Thank you. And what do you think is the most important thing that you have accomplished in your career?
I think I was involved a lot in heart failure, and I trained a lot of young people that they effectively can take care of people with heart failure, and hopefully being involved in the education of young doctors. I think this is the most important thing. So therefore, your effort here, being a cardiology of tomorrow, is most welcome to the European Society of Cardiology.
Thanks for the opportunity that the ESC is giving to us also. And what is the greatest advice that can you give to the young cardiologists that are starting their career?
Try to combine effectively basic science, clinical science, and help patient care with a good care for patients and a good empathy for these sick people. So the challenge is to combine everything to make good medicine which is evidence-based, which is based on scientific reasoning, and also to be a nice doctor and a nice guy to work with.
Mm-hmm. And the last question, to going beyond medicine and cardiology, what do you think is the right balance between medicine and personal life?
I think you need a good out of medicine activity like traveling, doing sports. You need a good family and a lot of good friends, and you should also enjoy life. There is no success without having fun in private life and in occupation.
Thanks for your advice, and thank you so much for this interview with us.